As a speech pathologist, when I think about childhood apraxia of speech, I think about a speech disorder rather than a global disorder or a problem that can cause other things. Apraxia really tends to ride along with other problems. So when you think of the number of interconnections that are in your brain, if you're having a pathway that's disrupted from getting from your brain to your mouth for speaking, there's quite a likelihood that other things aren't going to work as well. So the later language disabilities that show up or learning disabilities may be a result of neurologic issues rather than truly causal. And when we think about a recent study by it's Nip and Green and Marks, they talk about the development of cognitive abilities and language abilities and speech motor abilities as being very interconnected. So again, it's not maybe causal, but that interaction can lead to some issues that could be a problem for children in developing later problems. We know with young children who are not speaking yet, the likelihood that they may withdraw from communication due to frustration may make them look like they're autistic, or their movement and dependence on visual cues may make them seem to be ADHD. And so when we're looking at these really young children, being careful to sort out what's going on and why is really important to making the right diagnostic choice and thinking about the whole child and not looking to apraxia as the answer for if we fix apraxia, we'll fix the whole child and everything will be fine, or apraxia is the root cause for all of these other things, when in fact it's really more often than not the ride along. You can have apraxia by itself, and so we know that it can occur by itself without causing other things, but it can occur with a multitude of other problems, including autism or ADHD or sensory issues or language learning disabilities. So being aware of those interactions of skills and abilities is important. And then in thinking about intervention, we need to think about, is apraxia number one on our list of priorities when we have multiple things going on? Because in some cases a child with autism may need to work on communicative intent and engagement before we can work on speech production. Or a child with ADHD may need to work on behavioral interventions and or medication before they're ready to access learning efficiently, or controlling seizures, or a multitude of things. But then with some of those behaviors changing, the apraxia may rise to the top as the priority for treatment at that time. So we're always balancing what's going on, and having more than one thing complicates treatment, may make it go slower, but you need to be thoughtful and make your choices and do the best we can to help a child.